Shock 200. Clear.
Andrew.
Is in VF. Shock 200.
No pulse.
Clear.
Get a milligram of
Still
adrenaline ready,
VF.
please.
Setting 360.
No pulse.
Clear. P waves bearing no relation to ventricular
We
complexes.
He's a pacemaker.
3rd degree block. You going to be alright while I call the boss?
Safe as houses, mate.
Okay. Successful cardioversion following VF arrest, now stuck in 3rd degree block with severe hemodynamic compromise.
He needs a temporary pacemaker.
Yeah, Dr. Turner, I'm afraid I've only ever seen it done once.
Then you've seen one.
Look, Claire's not on call tonight, and I'd feel more confident if I was supervising this procedure.
Have a go. You'll be fine.
Yes, Dr. Turner.
Forgive me. Clearly, a 3-month waiting list is intolerable. But, privately, this is something we can do next week.
There's been a distinct lack of a mess party recently.
Oh, CCU had a night out last week.
Good.
Hardly anyone went.
Isn't it time for the docs to put on a do?
Yeah.
Heparinized flush, is that okay?
Yep.
And a feeder cath?
I'm fine with everything the way you're used to it.
If there's something you're not happy with, please do say.
No, everything's fine, thank you. Mr. Gibson, the first thing I need to do is to clean this area with antiseptic, okay?
You'll be putting the drapes on, won't you?
Mm-hmm. Yep. Just getting ahead of myself then.
2% okay for you?
Hmm? Oh, lignocaine, yeah, fine. Like I said, everything the way you're used to it. Okay, Mr. Gibson, I'm going to give you an injection of local anesthetic. I'm looking for one of the big veins that run towards your heart. Ah. There. Okay, Mr. Gibson, the next step is to run a wire down the tube into your heart, so we can then pass an electric current down that wire and control your heartbeat. I need the
wire?
Yep. The wire. Okay. Screen, please.
Doc, we've pumped a lot of rays into this chap.
Mr. Gibson, I'm having trouble getting the wire in exactly the right place to create a good heartbeat. Please, bear with us.
Andrew, isn't it time to get some help?
See if you can get Claire. She used to go out with that surgical registrar, Smedley. If he's on call tonight, he might be able to give us a phone number.
His rate's dropping. 25. 20.
Okay, let's connect the box up, see if we can get capture.
Five at 80.
Whatever. No capture, let's go to external pacemaker. Get me 10 milligrams of diazomals, please. Could you give me a hand? Thanks. Roll him on his side after 3. 1, 2, 3. Okay, Mr. Gibson, we're gonna control your heartbeat from the outside. We'll give you a sedative so you're not too uncomfortable, okay?
Let me see. Picture, please. I reckon that's about as close to the RV apex as this wire's been tonight. Okay, let's have a go. Set 2 millisecond pulse rate of 8 starting at 2 volts. Discontinue external pacemaker. Pace, please. Pacing at 1.5. Pacing at 1.0. Threshold at 0.8. Set 0.9.
Thanks, Claire. I'll suit you the wife here. Thanks.
Dr. Maitland, do I smell alcohol on your breath? I wonder if you could do a blood alcohol level for me, please.
What?
Me, actually. I might have to prove that I've had no more than a sip of wine tonight.
Send it down.
Thank you.
Something's got to be said, Claire.
What? Challenge the consultant's right to do private practice when he should be here? There's a hurricane in Florida. Why don't you go over there for a piss instead?
I tried calling you last night.
Your wife otherwise engaged, I presume?
Yes, Charlotte was at her mother's. I got to thinking. Claire and I haven't seen each other for a bit.
Get used to it.
What are you saying?
I'm saying, how can I break this to you gently? You're chucked, dumped, jilted. You've become a letter of the alphabet between W and Y.
What brought this on?
Kind of answers the question, really, doesn't it?
Oh, come on, Claire. Don't tell me you've got a man.
Adrian, there's a first time for everything.
Tell Scissors I'll see the patient at lunchtime. In the meanwhile, an ECG and a chest X-ray would be greatly appreciated.
Dr. Mortimer, can I have a quick word?
Celerity.
I wanted to get a comment for the evening edition. One of the hospital governors has described your condition as an immoral disease and described the decision to keep you on as madness. Well, as you know, the hospital is back testing on your patients. What's your reaction to the widespread panic that this has generated among members of the public? Some patients say you're putting them at risk. They say all doctors should be tested for HIV and ones like you should be kicked out.
I'll go along with that as soon as they start testing every bastard who comes through that door, asking for our help.
Since Mr. DeVries regards this car as an extension of his penis, I doubt you can begin to contemplate the seriousness of your crime.
What shall I do, Mr. Docherty?
Exercise the better part of valor, my boy. Eh? He who squirms and runs away lives to squirm another day. Piss off.
Just look at it.
I fear you suffered a frightful misfortune, Adrian.
You didn't see anything, did you, Ernest?
I fear the old peepers aren't what they used to be.
I'm pleased the patient is faring well. I must pass on my thanks to Claire. Good experience for you too, Andrew. I recall the prof in a waggish moment, defining experience as the quality one gains just after one has most needed it.
Well, Dr. Turner, with all due respect, I do feel that there is some cause for concern.
Oh? Regarding me, do you mean? Andrew, do you have an observation to make? You have a complaint regarding my availability on call, yes?
Yes.
Then you've already made it.